Welcome to episode 195 of Real Health Radio. You can find the links talked about as a part of this episode at the show notes at 7-health.com/195. That's SEVEN-health.com/195. Real Health Radio is presented by 7 Health. We work with women who feel obsessed with and defined by their bodies. Using a non-diet, weight-neutral approach that combines science and compassion, we help you to transform your physical, mental, and emotional health. We specialize in helping clients overcome disordered eating, regain their periods, balance their hormones, and recover from years of dieting, binging, exercise obsessing, and body hating by learning how to connect with and listen to their bodies. And we're currently taking on new clients. So if you're ready to get the support you deserve in healing your relationship with food and your body, please don't hesitate to contact us. Head over to 7-health.com/help, and there you can read about how we work with clients and apply for a free initial chat. That address again is 7-health.com/help, HELP. And you can also find it in the show notes. Hi there, everyone. If you're a regular listener of the show, then you know by now that we've been giving away a book from our resource list with every episode. It's our way of saying a simple thank you to you, our Real Health Radio community, while also asking for your support and feedback through rating and reviewing the podcast. If you'd like a chance to win, all you need to do is leave a review on iTunes, take a screenshot of it, and then email it to info@7-health.com. Then you'll be permanently entered in the drawing. You don't have to do anything else. Weekly winners have the opportunity to select a book from our resource list, which can currently be found on our website at 7-health.com/resources. It includes some of our favorite books and blogs. We plan to update it periodically with new titles that we come across, but if you want to see the list as it stands right now, you can head to that address or simply go to our website and click the drop-down menu on the left-hand side. For the book giveaway this week, the winner is Julie H. Congrats, Julie, and thanks for taking the time to review us. We'll be in contact soon to send you a book of your choosing. That's all for announcements, so about today's episode. I'm always honored to speak with our guests, but recording this one felt special. It was like I was talking to someone I'd known for years, a dear and brilliant friend. The conversation was dynamic and informative. At times it was even emotional. Yet all the while, there was this thread of joy and hope woven in every word. Jen McLellan is nothing short of amazing, and I'm so happy to introduce her to you today. Jen is a certified childbirth educator, wife, and mother to a charismatic 9-year-old. She's the host of the Plus Mommy podcast, published author, speaker, and founder of Plus Size Birth, the premier resource for all things plus-size pregnancy. With over 5 million page views on her blog, Jen is passionate about plus-size pregnancy, body love, and navigating the bumps along the road of parenthood. Though we didn't plan it this way, it seems quite fitting that this podcast, all about pregnancy, which is one of the many ways you can become a mother, would drop this week, days before we celebrate Mother's Day here in the US. So happy Mother's Day to all the mamas out there, and no matter where you are, or what you're celebrating, whether you're a parent or ever hope to be one, whether you identify as plus size or not, no matter how you journeyed to motherhood, and really, no matter who you are, rest assured that there's something for you in this episode, because Jen doesn't only talk about plus size pregnancy. She tells us about her own body relationship, finding size-friendly care providers for whatever your needs may be, how to be a compassionate ally, the difference between actual and relative risks, which is where my inner nerd was thriving during this interview, and a low moment in her life and work that led ultimately to the life and work she knows and loves now. It's a great chat, so let's get to it. Hi, Jen, and welcome to Real Health Radio.
Thanks so much for having me. I really appreciate it.
Yes, it's an honor to have you on the podcast. I'm really looking forward to it as a woman who has been pregnant, as a mom who, before we recorded, I was just talking to you about having kids home today unexpectedly, and also as somebody who has just such a wise and passionate voice in the area of plus-size pregnancy. I'm excited to talk to you, but before we do, could you introduce yourself and kind of what you do in your own words?
Sure. I know you read my bio, so that it sums me up. I would say I'm a mom first, and that kind of led me into this work that we'll share all about. But I'm a mom who had a story to tell, and that story changed my life and catapulted me into becoming certified as a childbirth educator, focusing in on supporting people of size during pregnancy, birth, and postpartum, as well as trying to conceive. I'm a public speaker, an author. I get to travel the country speaking to organizations about how do we support people of size in the healthcare world and mom conferences. And I'm most proud of collaborating with the National Institutes of Health recently on a Pregnancy for Everybody initiative. And I'm the host of the Plus Mommy podcast. So I do a lot.
Yeah, you do. And there's a lot to unpack there. I think where I'd love to start, if you're okay with it, is just to talk about, we do this often with our guests, but to talk about your own relationship with your body, because I'm assuming that some of that has sort of fed into the experiences that you had that created the story that you had to tell.
Oh, all of it. Yes. And it continues for sure. I grew up a chubby girl in Southern California, and I'm sure growing up a chubby girl anywhere is difficult, but it was especially difficult in a world next to Hollywood where you are just always fed these messages that you have to exist in a thin body. And I just really never did. And so that was really tricky to navigate, and a history of dieting and going to Weight Watchers when I was young, and all of those things that really played into just this distrust of my body and this not loving my body, or even thinking that I could love a body that was larger. And so that was really difficult growing up in that way.
And so then as you did get older, what happened? How did your body image and your relationship with your body evolve?
It got worse, really. I mean, the older I got, the more I ate those messages of self-hate, right? And when I was 19, I was going to community college, and I joked that it was high school with cigarettes. It didn't feel much different. And I hungered for a change. So I got on a plane and moved to Denver, Colorado on my own when I was 19, which was wonderful and exciting, but it also put me in a vulnerable position without a lot of support from family and no friends. And so I continued to do harmful things to my body to try to fit in. And thankfully, I ended up meeting a wonderful man who loves me for me, and we got married. And when I got pregnant and we were ready to start a family, it was the first time in my life that I was eating and not dieting. Like, I wasn't dieting. I was listening. I didn't even know what intuitive eating was, right? But I was doing it. I was listening to what my body needed. I was touching my belly in a loving way, in a way I had never touched it before. And the big catalyst, the thing that changed my pregnancy, my life, was that I hired a doula, and doulas support you with physical, emotional, and educational support during pregnancy. They're not care providers, but they're trained birth professionals. And I hired a doula, and I wanted an unmedicated natural birth. And she was just basically like, well, you should have a home birth, and why are you, doing these certain things? And I was like, well, I'm high risk. Like, I can't have a home birth, and I don't trust my body. And she was like, okay, well, that's fine if you don't want a home birth, but you should be working with midwives. And I was like, what? But I'm high risk. And she was the first person to tell me that I wasn't high risk, because everything on the internet told me I was. Every single website told me that because I had a high BMI, because I weighed, I'm comfortable sharing my weight and I self-identify as fat. I weighed 299.9 pounds when I stood on the scale at my first prenatal visit. So I just assumed that everything that said I would develop gestational diabetes, I would have a cesarean birth. And thanks to the comment sections in 2010, I read that I was a horrible person for wanting to become a mother as a fat person. So I believed everything that I had been set to believe my whole life. And this doula was just like, get over your weight. You're healthy. And no one had ever said that to me in that way. And, it was so powerful. And I was like, yes, ma'am. Like, okay. And I set up an appointment with a midwifery practice at Denver Health, which is a county hospital. And it was shocking to me to sit with this midwife that said the same message, only in a real, like, compassionate way. Like, your body is incredible. Like, you're going to water aerobics and eating these foods that fuel your body. Like, of course you can have the birth outcome that you want. And it was like, oh. And she's like, you're not going to have the posh, comfy couch hospital, prenatal visits. Like, this is a county hospital. We have plastic chairs, but you're going to have really great health care. And that I learned so much from that experience. Is we think when we get pregnant, it's all about like how nice the office is and, what meal do they serve after you give birth? And really those things are so not important at all. And I switched to a midwife. And at the age of 30, it was the first time a care provider ever touched my body with compassion. And that changed everything. It changed how I felt about my body during pregnancy. To this day, it gives me chills, and it helps me to advocate for myself in healthcare always. So that was the real shift of, oh my goodness, like my body is really strong and capable, and I can have a healthy pregnancy. And I did. And I gave birth on my knees. I mean, it in a hospital, like it just, everything was changed after that.
Wow, there's a lot that I have questions about there, because I think there's so much valuable information and insight to offer. I'm curious, if we rewind before you hired your doula and your doula was like, listen, you can do this. Who said you're high risk? Like, let's figure this out. Let's get a midwife team. Before that encouragement, were you working with a more traditional practice? And how was that experience if you were?
Yeah, I, like most people, just went to the same OB I had been going to because there's a comfort level there, right? Annual exams can be very intrusive. And when you exist in a larger body, I mean, I think you exist in a body of any size, right? Like that's an intimate experience. And so it was just easier to go with the person who had already seen my vagina and there was comfort there, right? And I remember her being like, well, I'm glad you're 30. Like the focus was glad you're not older and we'll just see how this goes. I was never outwardly shamed, but I never felt empowered. And I empowered myself, right? So everything online was negative about plus size pregnancy. It was all like obesity and pregnancy, dun, dun, dun. And so on my own, I had researched, okay, my risk for a cesarean birth is so high. Statistically, it's like over 50%. At the time, I thought, now knowing I know at my weight, it was about 80%. And that I need to be proactive with my health. So I was going to water aerobics 3 times a week and loving it. Like I was being physically active. I signed up for prenatal yoga. I was eating nutritious food. So I intuitively was listening to my body and doing things that I encourage people of all sizes to do during pregnancy. And it was coming from a place of love. So on my own, I was going down this journey, but I wasn't getting that support from the healthcare community until I switched to the midwifery model of care. And I want to be clear, there are incredible size-friendly OBs, absolutely. I'm not saying anything negative about the obstetric model of care. It's just a different model of care. So you have to decide what model of care is best for you. For me, it really was women-centered care and the midwifery model of care.
Mm. Wow. And so you mentioned it before, and I heard you say it again, this idea that you just naturally, upon becoming pregnant and recognizing kind of what your body was doing, that you just naturally became an intuitive eater after what we didn't really get into the details, but you mentioned you were doing some harmful things to your body as a result of your body image and your relationship with your body. So my assumption was, and I'm sure listeners' assumptions, you were probably dieting, under eating, overworking it, things like that. And then was the shift sort of like a snap of the fingers?
Oh, yeah. I mean, I had done everything on the list of harmful things around dieting and restriction and binging and purging, all those things, right? I had any diet, I had tried it. The shift was just so It was so intuitive. I mean, you read all the things online about pregnancy and what you should and shouldn't be eating. And so then part of that diet culture brain that I had grown up with was like, okay, I have to do all of this and I have to do it right. But then I started just to really listen to what my body wanted, and I craved so much watermelon. We went through like a watermelon a week. Like it was watermelon all the time, and we still make jokes about it. And it was just like, I don't know, like I was just really listening. It was such a shift from, I think back when I was when I was getting married. And in my office, I put up this sign on my door that said, "Don't feed the bride." And I just like, oh, I look back and I just want to hug that little, bride to be and be like, you poor thing. And I did none of that type of stuff when I was pregnant. I didn't say, oh, I can't have cake because I'm pregnant. I just ate the slice of cake until I was satisfied. And I just intuitively, it was like, okay, I'm done. Or I'd eat the whole piece and I wouldn't feel bad about it. That was so powerful, not to feel shame about food, not to think of it as good or bad. And I'm sure I did a little bit of that, but it just was really like learning about intuitive eating without even knowing there was a book on it.
Yeah, and that's something that happens so regularly. My clients know this of me. I'm always like, I'm not happy that you got sick, or I'm not happy that your body is in a position where suddenly the signals are amplified, and pregnancy would be one of those, which of course, if they're happy, I'm happy for that too. But my point being, a lot of times this happens around illness, when my clients suddenly have an experience where they're down with the flu or they got the stomach bug or something happens and they're like, oh, my body actually does talk to me. I know exactly what I want to eat and when I need hydration and when I need rest and how not to move right now. Because suddenly when your body is in a new state, whatever that state is, it can begin talking louder and you can get the messages more clearly. And that's the same sort of thing with pregnancy. So I'm not at all surprised how suddenly your body was doing this other job, sustaining your life and now the life that was growing inside of you. And it was like, hey, I'm going to speak up here, like turn the microphone up because I've got things to say. And you, thankfully, were so receptive to it, despite having been in what sounds like a disordered eating, diet culture, negative body image history.
Yeah.
You were still so receptive to that amplified voice of your body.
Yeah. And I think it wasn't just nutrition. Think about it. I put on a bathing suit and did a group exercise class, and was excited about it and loved it. Like, I don't think I ever would have gotten to that place if I hadn't done it pregnant. I mean, let's hope I would have, but I look back and I'm so proud of that girl that was like, oh, I read, water aerobics can be great during pregnancy. And I knew I'd always had gym memberships and been active in a larger body, but I never routinely stuck to anything because something would be triggered or someone would say something. It was like I had never routinely exercised without taking a break for so long and felt so good about it. And it just really also changed my relationship with exercise. Like, oh, I don't have to work out to lose weight. I can work out because it really makes my body feel good. And then I slept like a baby. And it was like all these things that we know, right, about the benefits of exercise and eating intuitively, but unlearning everything that I had learned wrong about why you eat certain ways and why you have to exercise, and just realizing that, oh, if I do these things because it makes me feel good, not to punish myself, but to love on myself.
Yeah, for sure. And it sounds like between the things that you were learning about yourself and your body, movement, nutrition, rest, all of those things, and the messages you were getting from your midwives, it really sounds like there was this health at every size focus, which isn't necessarily for the people listening to say everyone at any size is always healthy, because we know people in all size bodies can be healthy or unhealthy, but that doing health enhancing behaviors, having health enhancing mindsets, policies, facilities like the midwife community, that those are all more indicative of health than this idea, like you said, of I have to lose weight, or I have to eat exactly this way, or I have to force and punish myself through movement. There really is another more compassionate way to approach health. And it sounds like that's where you were at.
Oh, absolutely. And no one had ever told me that I could be healthy as an almost 300-pound woman. Like that message had never been there, even though all my blood test results were always golden. I never had high blood pressure. Like I never had anything to say I wasn't healthy. I just had all these messages and even care providers saying I wasn't because of my size. And all that did was make me continuously gain weight and punish myself my whole life. And that's really powerful. And when we talk about health at every size and reframing how we look at larger bodies, as we know and we have studies to prove that shame is not an effective tool. Shaming people doesn't help them to want to have access to moving their bodies in ways that feel good or learn about nutrition in a way that's not diet focused. Shame is not effective. So that's so incredibly important. And I want people to continue to hear that message. It's not just people of size sharing their stories. It's now all these studies that we have to prove that when people of size feel shamed, especially by their care provider, they are less likely to receive routine care and more likely to gain weight. So it's the opposite effect of what a lot of care providers, quote, want to accomplish.
Right, exactly. And I do have some questions for you about this, even about, and we can get into it in a little bit, because first I want to find out how you started then Plus Mommy and all the things that you're doing. But I do have some questions around this idea that, okay, so I do know that there are some risks for people in larger bodies who are pregnant, but I begin to question, because of the work that I do, because of what I know and understand about health at every size and weight, stigma, and oppression, like, are those risks, can we really say that those risks for a plus size pregnancy are related to being plus size more so than related to the bigotry and the stigmatization that happens inside and outside of the medical community? I don't know.
Oh, we'll dive into it all.
Okay. I'm so excited. I'm so excited to hear this from you. But okay, so you were pregnant, you worked with the midwives, you gave birth on your knees, had your son, and then what happened? Like, how did your life change to now you are the woman for a plus size pregnancy? How did that come about?
Yeah. So oxytocin when you give birth is like, I had never been so high in my life. Like in that moment of giving birth was like, I'm like forever changed. Like, how could I ever hate a body that could do something so magnificent? Why had I never believed that my body was capable, my body was worthy? And it was just like this shift, and obviously so many hormones, right, coursing through your body. But it was like, I was like a warrior, and it was amazing. And then, you learn about postpartum and you have this infant to feed and you never sleep. So, so while I was still feeling these shifts in how I viewed my body, it was also like adjusting to motherhood. And my son is 9 now, and I joke that I'm still adjusting. But he was born in August of 2010. And while I was navigating through those first few months, which are so hard, shout out to anyone who's in it right now, I just felt called to tell my story, and it didn't go away. Like, I was like, there has to be another narrative of what it's like to be plus size and pregnant. I would spend hours on Google Images looking for people who looked like me pregnant. There was no Instagram at the time. There was no hashtag plus size pregnancy. It was so difficult to feel like I was normal and that I could have a healthy outcome. And then here I did. I had a completely healthy pregnancy and I gave birth on my knees. And so I wanted there to be another story out there. So in April, and I'm coming up on my 9-year anniversary, on April 6th of 2011, I started a blog having no idea what it was to blog. I knew nothing. I picked the longest name ever, Plus Size Mommy Memoirs. Like, I had no idea that this would become my career and my life. Like, I just wanted to tell my story. And I remember setting up the Facebook page, because Facebook was like the big thing back then, and thinking, wow, it'd be so cool if I got 50 followers in a month. I was getting like 50 followers to 100 followers a day because no one else online at the time was having this conversation, especially around plus size pregnancy. And it just took off. And I realized, thankfully, within a month that this wasn't about me. This wasn't about my story. This was that I needed to create the resource that I couldn't find when I first went on that day when I got that, positive pregnancy test. I immediately went online and Googled plus size pregnancy, fat and pregnant, obese and pregnant, and could only find negative information. I found like one or two positive things. And so I coined plus size birth then in May of 2011, thank goodness. But my community had already latched on to plus size mommy memoirs and they had turned it into PSMM. And so it really became a part of them. So on social media, I always stayed as that like kind of plus mommy, but the core of my work and my website was plus size birth. So I ended up shortening it to plus mommy because it's more marketable, honestly. But yeah, so that's really what happened is I just felt called to share my story and then immediately realized that it wasn't just my story. It was countless people's story. And I can share a little bit more about how it evolved, or we can move on to more topics, but let me know.
Well, I am curious because that's exactly where I wanted to go with it, is hearing you talk about how this was your story and you didn't hear and see any other stories out there. So you brought this to the public through your blog and through Facebook. But you said it wasn't just your story. There were other people, obviously, if you're getting 50 followers a day, more and more people coming and following and obviously wanting to hear what you have to say. It's because they might have similar experiences or their own experiences to share too. So how did it shift from being your blog to being this company and this community? I do want to know that.
Okay. So in June of 2012, I was the breadwinner of my family. I had a background in nonprofit work. I was a volunteer manager for the leading end-of-life advocacy organization, Compassion and Choices. So my whole work history was end-of-life advocacy. So I did a lot around advance directives, helping to get laws passed around aid and dying, training volunteers, vetting volunteers, doing some public speaking. So all of that kind of set me up for now this birth work that I do. But I thought that was my life's purpose, really. I was so passionate about body autonomy, right, for end of life and having choice and care when you were terminally ill. And I got laid off. And the same week I got laid off, just a few days before the layoff occurred, I had a miscarriage. So within a matter of a couple days, I went from thinking our family was growing and so ready for the second child. I had a career that paid. My husband only had to work part-time and he was a full-time dad. Like our life was so beautiful and perfect. And I had this career that I had been doing for over 7 years. And there were so many exciting things happening in that advocacy world. And then it was all taken away from me. And it was devastating. I became severely depressed. And it was really one of the hardest times in my life. I felt like my body had failed me. And that was really hard to reconcile because I thought my body was amazing, right? Through everything. I'm so glad we talk way more about miscarriage now, but even just a few years ago, it was still so stigmatized and it continues to be. And then I no longer had the income and the fancy medical insurance and all the things that made our lives very simple. And it was 2012, so the economy was horrible. Unemployment had been extended because that's how bad it was. And I remember by the fall, my friends and family, thank goodness, were just like, okay, Jen, we realize that you went through a lot, but it's time to shake that off because you have something here. At the time, I had like 13,000 followers on Facebook, which was a big deal back then. And my website was getting, thousands of hits a day. And they're like, you have something. And I remember my mother saying, you're going to look back on this time and what happened as a gift. Sorry, it chokes me up saying that, because I was like, that felt like a stab through the heart at the time, right? But I did. And then in the fall, I took my first certification course on becoming a certified childbirth educator, because I realized I had built this great community and I was helping all these people and I was writing all these articles about all the resources. I couldn't find, like, where do you even find affordable plus size maternity clothes? And I had started talking about, like, how do you find a size-friendly care provider? But it was a lot of like, when will you start to look pregnant? And, the struggles around that when you're plus size. But then I realized, like, this is all well and good, and I'm so impacting people's lives, but I'm not able to create change. And I felt so called. And because I had that work experience of working directly with, doctors and hospice nurses, like, I knew some ways to interface with the medical community and some language to use. But I knew I needed some credential, right? And there wasn't enough time to pause and go get a degree. Like, I knew this all had to happen fast. So I became certified as a childbirth educator and immediately started public speaking. And that really catapulted plus size birth to it being recognized as like the go-to resource for plus size pregnancy. And since then I've written a book called My Plus Size Pregnancy Guide, about everything you could want to know about being plus size and pregnant. And, the site Plus Size Birth gets like 90,000 hits a month. And I do this work full time now, and it's changed everything for me. And I've been able to support thousands upon thousands upon thousands of people, and also have really helped to create change in the medical world and in the birth world. It's tiny, itty bitty little baby steps, but I'm proud of the change that has been occurring. And it's not just me. I don't want to say that. It's not just me doing this work. There are so many people out there advocating for themselves, doulas, helping their patients advocate, midwives that are size inclusive that are doing this work, and OBs as well. It is so many people coming together to say enough is enough. We need to meet people where they're at and support them with evidence-based compassionate care. So it's not just me, but I am thankful that my website and my work is really looked to as a very strong resource in this field.
Oh, I'm so appreciative that you shared that story, especially like the emotional part of your mom saying, hey, you're going to look back and be thankful for this, because I think about how you needed that, even if you didn't believe it at the time, like, even if you were like, no way, mom, you still needed that voice of, it's going to be okay. And let me support you in this. And I believe in you. And what's interesting, and I don't think ironic or coincidental at all, it's now you're that voice for so many plus size pregnant women who are coming to your resource, and you're saying it's going to be okay. Like this, like you're being the voice of even your doula, who you had that one personal experience. And now I love to see the ripple effect of how it is changing tons of lives all the time. I'm so grateful that you started that blog.
Thank you. Yeah, I mean, it just exceeded over 5.5 million page views since I started. And that to me is just mind blowing that, so many people have come and found this resource, and that it's everything that I searched for that I couldn't find. And for that, I'm really, really proud of, because I don't want anyone to feel how I felt, feeling that I couldn't have a healthy outcome, because that's so far from the truth.
Yeah. So let's get into that a little bit, because I think we've talked about how there's so many common misconceptions when it comes to women in larger bodies who are pregnant, and what that means for their pregnancy, for their child, and for themselves. Some that I've heard would be just the idea that it's harder to get pregnant, or that you're, like you had even talked about in your own experience, your own assumption was, well, I'm high risk because I'm in a larger body, or that the babies that are at higher risk for complications. Essentially, there is this idea culturally that it's just unhealthy to be fat and pregnant. And I would love to hear kind of some of what are those other ideas or things that women in larger bodies are hearing about themselves when it comes to getting pregnant, from conception to pregnancy and even postpartum. what sort of things are they up against?
Sure. I believe in sharing evidence-based information. That's really important to me. So if we look at the evidence, yes, absolutely. There are increased risks. When you exist in a larger body, you do have some increased risks. And I think it's really important that we talk about that, because when we know our increased risks, or we know things that we need to be aware of, that it empowers us to make choices in our lifestyle that can help to reduce our risk. And by that, I mean, it's the same for people of any size during pregnancy. The importance of moving your body and exercising and really eating, nutritious foods through, I think intuitive eating is very much should be a part of pregnancy for everybody. But, making choices with our nutrition to feed ourselves and our babies in ways that help us to grow and to be healthy. So those things are so incredibly important. When it comes to the actual risk, yes, there's an increased risk for gestational diabetes, preeclampsia. Those are the two that we hear the most. There are others. There's an increased risk in stillbirth. Yes, it does take longer to get pregnant, but all of these increased risks are very small. They are very small. The one that I hear the most is gestational diabetes. It seems to be this thing that even care providers who have a bias against people of size just assume that their patients will develop gestational diabetes. When we look at the research, depending upon your BMI, we're really looking at around a 15% risk of developing gestational diabetes if you have a higher BMI. And I can give you studies and stuff to put in the show notes. So what I like to say to people, and when I go speak at conferences, like I spoke at a labor and delivery nursing conference recently, is the importance of flipping the script. So we're still providing the same information, but instead of saying that, you have a higher risk of gestational diabetes, I say you have an 85% chance of not developing gestational diabetes. And here's what you can do to reduce your risk even further, because we know that physical activity and nutrition can play a role in helping to reduce that risk. So a lot of my work is presenting information, but in an empowering way that we say, okay, we know we have, like with preeclampsia, if you already have high blood pressure, then yes, you have a much higher increased risk of having higher blood pressure throughout your pregnancy, or because you exist in a larger body, yes, you do have a higher increased risk, but nothing says that you are going to incur these risks. And nothing says that there's this one thing that only people with a high BMI are going to incur because of their size. So it's really important to me that people go into their pregnancy feeling that they can do everything possible to reduce their risk and to have a healthy outcome. And that if they do incur any risks or complications during their pregnancy, to hold on to the truth that it happens to people of every size, and that I just don't want people to spiral down like, oh, well, I became a statistic. I hear that a lot. And it's like, you know what? Now's not the time to feel so badly about yourself. Sure, go there for a minute, but it's really a time to take that information or take a diagnosis and just allow it to empower you even further to walk down a path of breaking up with diet culture and really understanding how food can fuel and love on your body, and how to be active in ways that make you feel good. Because as parents, we want to impart all of this to our children. So pregnancy is this incredible time to change our relationship with food and exercise, and how we approach healthcare as a whole.
Yeah. I mean, there's so much that you said there that I was like, yes, and this, as you were talking. I mean, first of all, the idea that I know for myself, being in a privileged body, right? In the medical community, nobody's looking at me. I fall within whatever the normal, I can't stand BMI, but
yeah,
ta-da, for the medical community, it really works out for them. They don't have to go through their spiels about being lower or higher on the BMI scale for me. So that was the same for me when I was pregnant, and I got to walk right in and in this privileged body, not have what seems to be, and because now doing the work that I do, working with women in all different size bodies who have had many different experiences, one of the things even a recent client just said to me is like one of the most hellish experiences she ever had in her body in terms of how other people treated her was being pregnant, and the medical community focusing on her size instead of her pregnancy and instead of the baby and her body. And so I'm hearing that from my clients as they have either gone through it or going through it while we're working together. But for myself and my own experience, I wasn't hearing, oh, well, you're at more risk of this or you're at more risk of that, which again is this idea of speaking to your patients with relative risk. Like, well, compared to, I don't know. I don't care about someone else. Like you said, what is my actual risk here? And how can we say it in a way that reframes it to say, oh, instead of you have a 15% chance of gestational diabetes, you have an 85% chance of having a healthy pregnancy here. I think that is so important. And another thing you said that I just want to call attention to is this idea that risks happen across the board. If you are a human who can or has gotten pregnant, you are any of these things, any of these complications can happen to you. No one is immune. I myself have had multiple miscarriages, a C-section, an extremely high risk pregnancy, and again, in a body that's privileged when it comes to how I am treated in the medical community.
Yeah, you said a lot. I was getting excited in the background. BMI, I don't think people realize BMI was established in the 1900s by a statistician. Like, it was never intended to be used the way it is used today. And the fact that it is still used in the way it is today is just mind-blowing to me. So yeah, it's very, very, very frustrating. And I'd love to explain relative risk versus actual risk. You just did a brilliant job of it, but digging into it a little bit more, because I think it's so important that we understand the differences. So it is very common for people of size to be told and to read, you have a much greater risk of developing gestational diabetes. And what I'm hearing more and more is you have a much greater risk of having a stillbirth. So I pulled up some numbers and I'd love to walk through it. So a relative risk is a rate compared to another rate. So we're comparing someone with a BMI of 20 versus someone with a BMI of 35. That's a relative risk. And then the actual risk, like you said, is what is my actual risk of this? So I know that stillbirth is very triggering, but it is something that I want to use as an example here because it's how people are being, I'm going to even say, manipulated by the medical community to make decisions for their healthcare that aren't necessarily evidence-based. We look at the cesarean birth rate for people of size as astronomical, and that's where I really challenge that there's a lot of bias against how people of size are treated in the medical community, and we have studies to back this up, versus that, 80% of people with a BMI over 60 actually have to have a cesarean birth. And then for people with a BMI over 40, over 40, it's over almost 50%. So they're just really, really, really high numbers to me that don't make a lot of sense. So when we look at stillbirth, I have this example of this woman, Sarah, right? So Sarah with a BMI of 35 is told she is 78% more likely to experience a stillbirth during a pregnancy. What does this actually mean? So for someone with a BMI of 20, their risk is 40 stillbirths per 10,000 pregnancies. For someone with a BMI of 35, oh, I'm sorry, and I want to break that down. That is a 0.4 chance. So 0.4 of having a stillbirth during pregnancy. So Sarah with a BMI of 35, it's 72 stillbirths per 10,000 pregnancies. Sarah's risk is actually 0.7. So we went from 0.4 to 0.7. So when we're just comparing the two numbers, yes, she's 78% more likely to have a stillbirth during pregnancy when we're comparing it to a BMI of someone who's only at 20. but Sarah's actual risk, her actual risk of having a stillbirth is 7%. So I hope that makes sense. It's easier if you see it on a slide, but I hope it drives home the message that we need to be asking our care providers when they say your risk is so much higher, ask them, what is my actual risk? And I wouldn't be surprised if they can't answer it for you, because there's studies, right? And we have studies on obesity and pregnancy, and I hate the O word, but we have these studies, and we have to look at what's behind these studies. Was every person of size evaluated in this study? Did we look ahead of time to see if they already had high blood pressure, if they already were pre-diabetic? And the answer is, I don't know, or no, or maybe. So we're just starting to see more studies. There was one out of the UK around looking at women on their second time of pregnancy who were indeed low risk, did not have high blood pressure, did not have any signs of being, pre-diabetic. And we see lower risk profiles for these women with a higher BMI than first-time moms with a lower BMI. So there's so much to it, and it's a lot, and it's overwhelming. And so at the end of the day, I want to say, yes, people of size have increased risk during pregnancy, and we need to talk about them, but they are nowhere near as astronomical as they are presented to the medical community. And we need to use that information to empower ourselves to be healthy and physically active and working with a size-friendly care provider throughout our pregnancy.
Thank you for explaining that so thoroughly. I think the way you explained it is so easy to understand, and hopefully people are realizing the trauma and the fear-mongering that's involved with someone saying, oh, you have a 78%, higher chance of this horrifying thing happening as compared to someone else, instead of really hearing, oh, you have a 0.7.
Yeah.
So what was that? Is it 0.7%?
Yeah.
Yeah. Like 0.7%. I'd be like, I have more of a chance of, I don't know, a bird pooping on me probably than actually having that experience. But when you hear it compared, I think what it is, and I think what really bothers me as somebody who is paying attention to these things, is the idea that everything in the medical community and our culture at large is in the context of what's quote unquote normal is a tall, thin white woman. But like what's quote unquote normal is this one body type. And now every recommendation we give to you, all of the treatment we give to you, any conversation we have with you is always going to be in comparison to what we would like to say for our own beauty ideals is the quote unquote norm, which actually isn't even the norm when it comes to sizes. But I can only imagine, because it's not something I've experienced personally, but the pain of constantly feeling like all of my health advice, all of the conversations around me and my body and my pregnancy and my child are in the context of comparing me to something else that is like seemingly better in the medical community's eyes, just based on the way that they posture these sort of statistics and conversation.
And I do want to be sure to say, when we say statistics, and I'll give you this article in Stillbirth if you want to put it in the show notes, your risks do increase as your pregnancy progresses. With stillbirth, those numbers do go up for people of all sizes. So I don't want someone to say, oh, I heard on, the Real Health podcast, I only have a 7% stillbirth. That's earlier on during your pregnancy. So you can definitely read it. But the point of it all, and I'll link to the study as well. The study is linked in the article. The point is exactly everything that you just said. And that I've heard from a lot of people that they are told on their first prenatal visit that they need to have a cesarean birth based only upon their BMI. There is nothing put out there by ACOG, which sets, the standards and guidelines for maternity care, that says that someone with a high BMI should have a cesarean birth based only upon their BMI. There is plenty of evidence and research to show that a cesarean birth is not the ideal outcome for a person of size, and there are much greater increased risks during surgery and postpartum. So I firmly believe, and I'm thankful there are studies now to show that care provider bias does play in a role in how people of size are treated. And just some studies, there's one that shows that more than 50% of physicians view obese patients as awkward, unattractive, ugly, and non-compliant. 74% of medical students in another study exhibited implicit weight bias, explicit attitudes that were more negative towards obese people. Just another one that showed the majority of registered nurses and nursing students believe that fat people, quote, liked food and overate and were shapeless, slow, and unattractive. Like, these things are so like, oh, it hurts to hear. But it's now these studies just show all these things that people of size have been saying forever are now backed up in studies. So now we're having classes where medical care providers are taught how to treat people of size with compassion. And it's just like, I'm glad it's happening, but it's, 2020. Like, oh my gosh.
Yeah, absolutely. And that sort of gets into the question that I had earlier that you're like, oh, we'll get to this. But hearing all of these statistics and outcomes of the way that people in the medical community, staff in the medical community feel towards individuals in larger bodies, I can't personally look at then any statistic, any outcome around number of cesarean births, gestational diabetes, some of these other risks, and go, oh yeah, well that risk is definitely based on like body size and weight then, because clearly then in all of these experiences, in any of these experiences with the medical community, there's stigma and oppression happening. So how could I differentiate, oh, is this really about your body size, or is this about the bigotry of the communities you're in?
Right. And that's why I focus on, let's focus on how to be healthy throughout our pregnancy, and let's focus on connecting with a size-friendly care provider, because if we're doing those things, then we're helping to reduce our risk no matter what they are, no matter what the percentage is. And how I define a size-friendly care provider is someone who provides evidence-based, compassionate care. And I have a list of things that I define that as, and I can read them off for you. But when I was at that nursing conference recently, it was a room of, just over 100 labor and delivery nurses. And so I read this, I'll read it to you. I read this to them, and it's on the slide, and it's short. And then I asked them if they self-identified as a size-friendly care provider to raise their hand. So let me read this to you. A size-friendly care provider is compassionate, aware of their personal biases, provides individualized care, no high-risk classification based only upon BMI, does not make assumptions about nutritional or physical activity by the way someone looks, and treats patients with dignity. I don't think it's too much to ask for any care provider to say, yes, I raise my hand to all of those things on this list, right? And it was shocking to me that like under 20 people raised their hands. I mean, the majority of the room did not raise their hands. And it like totally took me off guard, because I wasn't prepared for that. Naively, even after doing this work for almost 9 years, like I was not prepared for that. And so it's really important to me that I then go through the list of all the larger equipment, and how I always start this conversation about what it is like to be size inclusive is to use the very clear and easy example of a chair without arms. So if you walk into a lobby, or let's say, Lou, you existing in a smaller body, walk into a restaurant, like, that you can literally sit anywhere most often, right? And you are an able-bodied person. You can sit in most chairs. I, however, cannot. Existing in a larger body, I navigate the world differently. And when I walk into a healthcare provider's office and all the chairs have arms, it is very likely that I don't have somewhere comfortable to sit. And what that says to me is I'm not welcome here. So I want this to be heard for not only practitioners listening, but if you have friends that exist in larger bodies and you go to the restaurant with them, like, if you arrive earlier, don't pick a small booth. watch out for chairs without arms. Nearly all restaurants have one that they keep in the back just in case, but just be mindful that people in larger bodies exist in the world a little bit different. And if you just show an ounce of compassion, it can change how someone feels about their body and how they feel that they have access to healthcare. They have access to go out in public and be treated with dignity. It is such a small thing that cuts so deep and goes so far.
Absolutely. I know there's apps out there. I'm actually hoping, fingers crossed, to interview one of the creators of the Augo app, which is right now based in Washington, and it's about restaurants, specifically like you said, and it's for people in larger bodies to be able to communicate with each other, sort of like Yelp reviews, but for restaurants and spaces specifically. Are they designed for? Is their staff aware of, compassionate, kind? Are they giving as much credence to and attention to people in larger bodies as they are to people in smaller bodies, in terms of the way that their restaurant's designed, the way that the facility looks and feels and accommodates people? And I think that's so important. I'd love to see an app like that for like all the things, for medical offices and for other places and public spaces as well.
Yep, Rebecca, she's coming on my show on Thursday. We're recording, and I will connect you to her, Lou, because she's doing incredible work. Her team is. I know it's still in beta, and like you said, it's just in those 2 states, but I definitely foresee it going everywhere, and it needs to. Like even, Roxanne Gay was coming to speak in Santa Fe, and I really wanted to see her, but I knew it was at a very, very old theater, the historical building, and I just knew that the theater seats in really old theaters are not accommodating to people of size. And was I going to miss seeing an author who I deeply admire? No. Did I need to call ahead and make seating arrangements for myself? Yes. Did I show up and they didn't have it all noted and I had to advocate for myself in that moment? Yes. But I did it, and I got to see her, and it was harder and it was embarrassing, but I did it. And that's a lot of the work that I do on Plus Mommy and the Plus Mommy podcast, is like, how do we navigate the world in a larger body, and how do we as plus size moms and all that comes with that, and parents, and also how do we unpack years of diet culture and just focus on intuitive eating and moving because we love our bodies. And all of this stemmed from my pregnancy. And so, yes, my mom was right. I'll have to call her, Lou, after the show and thank her again and tell her it was right, that it was a gift what happened, and that catapulted my work. But ultimately, going back to the size-friendly care provider, I just think that it's so important that we, as people of any size, right, find the very best care providers for ourselves. You do it for your kids, right? If you were a parent, you research the heck out of your pediatrician. Did you do the same for your doctor? Ask yourself that question. It is so important.
Yeah. And so you mentioned the seating, which I think that's something you can walk right into a waiting room and see. One of the first things you walk into the doors of a new medical facility, you can see, is there a place for me? What other indicators do people have when they walk into a place? They're pregnant, they're excited, they want to get proper care and treatment for their pregnancy. What are there other things, clues that they can pick up on that they are indeed at a size-friendly provider?
Yeah. And on my website, I'll give a little shout. I have a free guide on how to connect with a size-friendly care provider. It's the sign up for my newsletter on plussizebirth.com. But just a few things from that I can share is, it starts even before you show up in that lobby. It starts with researching, the care provider, back in the day of like internet, I mean, it's still today, but like internet dating, if you were dating before you got pregnant and scoping out someone online, like you Googled the heck out of them. Google your prospective care provider, read reviews, read for anything that shows signs that they might not be size inclusive. Ask people in your community. I think if you are newly pregnant or trying to get pregnant, join local Facebook groups. That's such a wealth of information there. And if you feel comfortable saying, hey, I'm plus size and I'm looking for a size-friendly care provider, I just found out I'm pregnant, It'll be so interesting for you to read who's recommended, who's not recommended. Doulas are the gatekeepers to their community. They know which care providers are the best for VBAC, which is vaginal birth after cesarean locally. They'll know who you should go to. They're also becoming a lot more educated about size-friendly care providers, and a lot of doulas. I have a resource list of size-inclusive doulas, and so doulas are knowing, like, okay, keeping an eye out for these things. So I think the research piece before you even show up in a doctor's office is so incredibly important. I think it's important to research the midwifery model of care and the obstetric model of care, and then you decide what's best for you. But once you've narrowed down that list, and obviously we have restrictions with medical insurance as well, or what access you have to healthcare, then when you show up, looking at that lobby, how are you treated by the front desk staff? That's so important, right? It starts there. When you're taken back, the first thing we do is get weighed. So how do you feel about that? You are a mentally competent adult. You have every right to not do whatever you don't want to do during pregnancy or not during pregnancy in healthcare. And I don't think we realize that we have the ability to say no. We have the ability to fire our doctor. We are owed informed consent on everything. And informed consent isn't just saying, yes, I approve to this procedure. It is you understanding all the pros and cons of the procedure and consenting to that. So for something as simple as getting on a scale, if weight is triggering to you, then you can say, I'm going to stand backwards. Please don't say the number. I weighed at home. Here's my number. I'm not going to stand on the scale. Or you simply say, I don't want to be weighed. Will you get some pushback from that? Absolutely. Will you take the time to be open-minded to why they want you to be weighed? I think that's so important. Weight is one measurement that we are so stigmatized to, and I understand that. And you certainly don't need to get weighed if you sprained your thumb and are going in for that. But during pregnancy, it is helpful because they're able to look for any red flags if your weight dramatically increases or decreases. So I'm going to advocate for you if you feel comfortable with it getting weighed, but you don't have to see the number. You don't have to be told the number. Stand on that scale backwards with no shame. I will cheer you on. So that's really important. Another thing that is so critically important is the correct size blood pressure cuff. If your medical facility or home birth midwife does not have a large adult thigh cuff that's being used, if you have larger arms, then run. Do not have your blood pressure taken by a cuff that doesn't fit your body, because you will get an inaccurate reading and you will be told that you have high blood pressure. There are countless stories of people being put on medication that didn't need it just from the wrong size cuff being used. So those are all things. If you have to undress, do you have a sheet or do you have a gown that fits your body? This is so critically important because when you feel covered, that gives you your dignity, right? It makes you feel comfortable. It makes you feel able to advocate for yourself and ask questions. But when we are literally naked and not covered, we are so vulnerable. So all of these things are so important. And how, when you get into the room, is there a chair without arms in the room? This isn't just about the lobby. Can you sit comfortably in that hospital room, in the exam room, where you don't necessarily have to sit on the exam table? Because the exam table is another place where we feel vulnerable. You can't always completely feel comfortable advocating for yourselves when you're sitting there versus sitting on a chair where you're more eye level with your care provider. The body language your care provider uses when they touch your body, when they're talking to you, how do they make you feel? And one question that I always encourage people to ask is, what is your experience working with people of size? And do you have any specific guidelines during my pregnancy that I need to be aware of now? And that'll give you a clear indication of, are they telling you you're going to be tested, monthly for gestational diabetes, when we know that people of size should just be tested in the beginning of pregnancy, and what they're looking for there is to see if you're already pre-diabetic or diabetic. And then when everyone later on in pregnancy is tested, that's the norm. That is what ACOG says. But if you're being tested more than that, that might be a red flag. So sorry, I could just keep talking on and on, so I should stop. But ultimately listen to your intuition. What is your gut telling you about all of this? And do not feel afraid to get a second opinion or to switch care providers. You would do it for your kids, do it for yourself.
I really appreciate that advice. And I thank you for being thorough, because these are really important things for people to hear who are in bodies of size, who are experiencing, prenatal care and going through that. But I also think it's important for those of us who aren't, whether we're not at the place or desiring to be pregnant, whether we're not in a larger body, whether we're practitioners or we work in a medical community. I think this is so important to hear and be aware of too, because at the end of the day, and I'll say this on every single podcast episode I host, and people might get tired of me, but at the end of the day, it is not people in larger bodies who are responsible for creating safe spaces and communities for themselves. I'm so glad that you are advising people to advocate for themselves. I think it's so important because they're worthy of that. We all are worthy of advocating for ourselves. But at the same time, hearing this is hopefully giving information and insight to everybody that they want to create safer spaces and they want to call out when a space isn't safe, and they might be able to speak up for and advocate for their sister if they're accompanying them at a prenatal visit, or their partner or their friend, because these are like microaggressions that happen all the time towards people in larger bodies that just go unspoken and unthought about so often.
Thank you. Thank you for what you said and what you do. And I mean, we need thin allies and we need people, because it's not that much to ask for, right? It really, at the end of the day, isn't. And I think we have this misconception about what plus size pregnancy is. And people think it's people who exist in much larger bodies like I did, or all these sensationalized TV shows on TLC that make me cringe. But when we look at the statistics, it's 60% of women in their childbearing years are classified as overweight or obese. So we're really looking at kind of the majority, and we need to be cognizant of that and be aware of that in our work. And instead of thinking of it as like, oh, there's this crisis and we need to do, it's like, no, we need to actually like slow down, take a deep breath, and start treating teenagers. My God, if I had been touched by a care provider with compassion when I was 16, I can only imagine how that would have changed my relationship with my body back then, right? Compared to when I was 30. So we actually need to be really focusing in on evidence-based compassionate care versus scaring people into making choices and decisions that aren't necessarily in the best interest of their health, physically and emotionally.
For sure. And I appreciated your advice too about informed consent. And it's always okay to ask why, and your practitioner, your doctor should have an answer for you that sits well. So if it's, why do I need to step on the scale today? Oh, because we are administering a medication that's weight-based, or, oh, because we want to make sure that you haven't had any major changes or shifts in weight that could be indicative of other conditions. Okay, great. So if I don't have those, don't tell me, is a much more informed, peaceful sort of experience than just being thrown on a scale and someone shouting a number at you and really not having context for it, but maybe hearing a tone of voice, or like you said, just not having that compassion that you talked about. And what you said also is so true. Yes, we always have to talk about opportunity and access and availability of care, but when and if it's possible, these people work for you. And that's something I try to tell my clients all the time. Like, no, your doctor works for you. They should answer to you. They should be available for your questions, and they should help to, they should be able to explain what they're doing and why they're doing it. They should be able to tell you specifically why they've made the choices they have and what other choices are available to them and to you. All of that that's a part of their job.
Yes. Yeah, we forget that we're paying for this service, right? I would love to share a resource on how to get informed consent, how to really know if this is something that you want or need. Obviously, when we are giving birth, right, there are sometimes emergent situations where care providers don't have time to give informed consent. this is an emergency. You need to have a cesarean right this minute. There are those times that happen, but more often than not, there is pause. There is time for you to really decide if you want to be induced or not, if an induction recommendation is being made, if you want Pitocin or not. Like, there are so many times during labor and birth where we actually have a lot more opportunity to ask questions as opposed to just say yes. But this acronym is not only for those who are pregnant. It is definitely for something that I'm using for the rest of my life, and I hope others will too, because it really helps you to understand what you are consenting to and what your options are. So it's a childbirth educator's best friend. It's called the BRAIN acronym. So it's BRAIN. So, and I can send you this meme, this image I have too, if you'd like, but it's, or you can find it online. Childbirth educators love it. So here we go. B, what are the benefits? R, what are the risks? A, what are the alternatives? I, always listen to your intuition. N, what happens next or if we do nothing? So when you're being faced with a decision around your health care, let's say even you're not pregnant and a care provider is recommending major surgery, pull out this list of questions and sit there and be like, what are the benefits? What are the risks? What are the alternatives? Listening to your intuition the entire time. And then what happens next, or if we do nothing? Then you are given full informed consent to make that decision. That is so much different than being handed a piece of paper, being told what they're recommending, and you signing away.
I love that. I'm going to use it now for myself and for others. It's perfect. And so succinctly shares, what informed consent really is and should be.
Yeah. And I would use it for our kids too, right? I mean, this is something we can use for our whole lives in medical care. And I think it's such a handy tool. So just use your brain.
Thank you. I love that. If we make a shift from sort of the medical side of pregnancy and postpartum to the social or cultural side, there's still a big gap there. There's still a need for representation and for, I'm just thinking, when I think about things like breast pumps or baby carriers or so many things that based on your body size or your ability status, there aren't necessarily tools created for everyone, clothing created for everyone. What sort of other hurdles are there in being a plus size woman in a pregnant body outside of the medical community?
Oh, yeah, right? Like if you don't even have access to maternity clothes that fit you, then you clearly get the message that you shouldn't be pregnant, right? Which is so far from the truth. You know, it's such a shocking reality when you go online and realize how limited the options are around maternity clothes. I mean, really the only in-store experience you can have that still only goes up to a 3XL is motherhood maternity. I know Walmart has some options. Target goes up to 2XL. Like the options are really, really limited. Thankfully, there's more online stores, but there is something about being able to walk into a maternity store and see other people pregnant and shopping. And it is so disheartening to walk into a motherhood maternity and have to walk all the way back to the one tiny rack that has 1X, 2X, and 3X, and that's it. Like, it is so frustrating, and it was just as frustrating when I was pregnant in 2010 as it is today. Thankfully, we have a lot more online resources. I, of course, have a ton on plussizebirth.com. Etsy is awesome, a wonderful place to find gorgeous plus-size maternity gowns. So that leads me into saying that maternity photographs of people of size were something that I could not find, hardly any, when I was pregnant. And so I never thought that I could take pictures or should take very many pictures. I mean, obviously I have some selfies, although back then it was like flip phones, so my selfie quality is pretty sad. But my husband took a few pictures of me, but I have a handful, and that's it. And I'm so thankful that social media has really changed the landscape of pregnancy for people of all sizes. I do something pretty powerful. When I talk at birth professional conferences, I have these screenshots of pregnancy magazines, and they're all thin Caucasian women. And so I say, did you know that only thin Caucasian women get pregnant? And everyone laughs. And then I unpack how wrong that is. That people of all sizes, colors, abilities, people have bellies that don't look like this traditional D. And very often when you are plus size and pregnant, you have a belly that looks more like a B than a D. The most popular article on my website is What's a B Belly? Because no one had talked about it. It's like there wasn't an article on that, and yet I had a B belly, and so many people I know have a B belly. So it's just normalizing these experiences. And when we see images of people who look like us pregnant, it really starts to shift and help us to realize that, oh, I can look this way too. And even if I don't look pregnant until the very end, or maybe don't ever look pregnant, like there are some wonderfully skilled photographers that can help you have these gorgeous maternity photo shoots that you maybe didn't think you had access to until you saw someone else in that photo. I think those things are so, so important. When you said breast pumps, it's really the phalange that's more important than the actual pump. So just knowing that, and knowing that people of size have lower outcomes of breastfeeding numbers. And I think bias plays a role in that. I've heard from people and had my own experience because I have large breasts. And again, not everyone of size has large breasts and all these assumptions that are made, but I heard, be careful that you're not smothering your baby. And when you hear something like that, it just makes you like terrified every time you nurse. We do know from studies that the best thing to really help people of size, but of any size, with improving breastfeeding outcomes is to connect with an IBCLC. So they're the highest level of certification for getting breastfeeding support with a lactation counselor. And I think that is so important. I fully regret not getting that support when I was having my own struggles. So I encourage everyone, it is worth the money, because you will spend more money than you ever thought possible with formula. But I want to be clear, as someone that did become a formula feeding mom, there's no shame in that either. So you do what you have to do and the best capabilities that you can. But I just want you to know that there are resources out there that I didn't realize I should be tapping into. And so I have plenty of stuff around plus size breastfeeding as well. But yeah, baby wearing has gotten better because there's a lot of women in the baby carrying industry that are like, carriers should be size inclusive from the bat. So carriers like Augo and Tula and mini wraps are actually size inclusive, and I have a great list. So thankfully that, but the clothing industry in and of itself is finally catching on that plus size people have money and we want to spend it on clothes, and this is just now happening way outside of maternity clothes. So I know maternity clothes will get there and we'll catch up finally, but we're not quite there yet.
Thanks for sharing all of that. And one of the things, the photography side of it, and seeing plus size women throughout their pregnancy is something I don't really see a lot unless it's on your website or your Instagram account, or shared in other pregnancy spaces. I am seeing a little bit more of it. But besides like Ashley Graham and Tess Holliday, I don't think that anybody has gotten, like, if we're thinking of like magazines and articles and cover stories, I can't really think of anyone besides, like you said, like only, can you imagine, only thin white women can get pregnant? That's what we see day in and day out in these publications.
I'm kicking myself because I can't remember her name, but she was that awesome actress in Orange is the New Black that just had her baby, and she's a woman of color, and she was really bold and outspoken about her pregnancy and frustrations. Her name's, I remember her name on the show, but I don't want to say her wrong name. I could look it up, but she's definitely been wonderfully outspoken. She has her baby now. So, but yeah, it is really limited. I will say I'm very happy that the hashtag plus size pregnancy has reached almost 50,000 images being shared. So I think that that's incredible. You know, I think there's a stigma to even identifying as existing in a larger body. It took me a very long time to be okay saying I'm a fat woman. So even if people exist in a larger body and take photos, they're not necessarily like hashtagging themselves as plus size. So I think there's a lot more imagery out there than we realize. But I'm not seeing as many online magazines and print magazines embracing people of size. It's starting. The shift is happening finally, but it has been a very, very long fight to get to even where we are at now. I mean, I've been fortunate enough that I've, written articles for, Today's Parent and Lamaze and Cafe Mom and like so many that I've really worked to put myself out there and help to start change that narrative. I was recently featured this last year in 2019 in Glamour magazine about being a plus size mom. So that was something that was shocking to me. Like I was like, wait, a Glamour magazine? Like, am I being punked? I never imagined myself in Glamour magazine because that's just a space where I thought fat people didn't exist, but they did this whole big expose almost on like being a person of size and many, from fashion to motherhood to everything, and talking about how we need to be inclusive. And it was like, wow, it's finally happening, because there's just so much shame when you don't see yourselves, and it only continues to perpetuate the negativity that I thought I had to feel about my body until I was able to see people embracing and loving themselves at any size.
Yeah, that's where I was going to go next. It's Danielle Brooks?
Yes, Danielle.
Okay. Yeah. But so that's the actress on Orange is the New Black who, I'm actually looking at her Instagram now with all of her beautiful shots of her pregnant body. And, but I was going to ask you, what's the outcome then and the implications of not being represented in these spaces, whether it's clothing or photography? You started talking about that, but I'd love to hear more. What does that mean then for the plus size pregnant woman?
When you don't see yourself represented, when you don't see yourself included, then you immediately think there's something wrong with your body, that there's something wrong with yourself, that you don't have access to things that other people do. And so then it's so easy to believe the messages that you cannot have a healthy outcome. So then you don't fight for healthy behaviors that will only, help you have a better outcome during your pregnancy. I've heard so much like, well, then they get tied back into emotional eating and dieting. And I hear incredibly self-destructive things like people being told, I don't want you to gain any weight during pregnancy. So then people just stop eating. I just interviewed someone for my podcast recently who did that. Her doctor said, well, you should probably stay away from carbs. Don't ever tell a pregnant person to stay away from carbs. Like there's such a difference between, hey, we're seeing some significant weight gain. I'd love it if you felt comfortable, talking about nutrition. Can you journal what you're eating, which pros and cons there, right? That can be triggering for people with disordered eating. But really looking at nutrition and making recommendations. Highly recommend connecting with a size-friendly nutritionist. Working with a nutritionist during pregnancy can be wonderful, and it's actually a recommendation that ACOG has for people of size to work with a nutrition. Is there's such a difference between working with a nutritionist to help you even probably eat more than you ever realized you needed to be eating, like helping you actually eat, than starving yourself or making really self-destructive choices because you are coming from that place of shame and belief that there's something wrong with you.
Or just the idea that this pregnancy and this choice in one's life isn't embraced in the same way as people in more privileged bodies, I think is just so gut-wrenching for me to consider, because it's for many a really magical and for some a long-awaited time in their life, not for everyone. But for many people, it is. And then to have that, to be like you had mentioned earlier in this interview, thanks to the comment section, being concern trolled and people telling you how awful you are if you're in a larger body and you're pregnant. Those sort of things are just so unlovely and not how you want to feel when you're doing this new thing in your body and carrying a new life along with it.
Oh, yeah. Oh, absolutely. And it isn't just the concerned trolls online. It's your mother-in-law. It's your best friend making comments that can be very hurtful. I hear often assumptions about gestational diabetes and that when are you going to get it? And it's just this idea of the minute you get pregnant and exist in a larger body, you don't exist. You can't have a healthy outcome. You can't embrace your body. There's not a place for you. It's so destructive. And so that's why it was so important to me from the beginning to show images of people who didn't just look like me, plus size and pregnant, but people of color and people in LGBTQ communities. I mean, so many different stories that has been important for me to share because I've always wanted anyone who existed in a larger body who got pregnant to find themselves and to know that they're not alone. You feel so alone. I mean, it does take often for people of size longer to show, longer to start feeling movement. I mean, if you come to pregnancy already having a belly, you're going to measure ahead during your pregnancy at all times. But those things aren't talked about and they're not normalized. And when you just know that this is your experience and it's okay. There are people who exist in very small bodies and they have a different pregnancy, looks different for them too, but that's okay as well. You're pregnant. Now's the time to tap into and love your body unlike never before. And I think now's the time to really focus not only on your physical health, but your emotional health and your mental health. That is so important. And we don't talk enough about, we talk a lot about now about postpartum depression, and I'm so glad, and that's so incredibly important. But we don't talk about depression during pregnancy. We don't talk about anxiety during pregnancy and all these things that you're afraid to see a therapist or you're afraid to get help when you're pregnant, and that you shouldn't be afraid because asking for help is a sign of strength. And it's really important that we talk about these things far more often. And when you don't feel that you're represented and you feel that you're being shamed, it can only elevate all these things that you're concerned about and further depression as well. So it's really important that you know that there are outstanding resources out there like postpartum.net, which, yes, postpartum is the focus of their work, but they also have so many mental health resources around pregnancy as well.
And I think that aspect is so important. We talked about it earlier because those experiences that we're having in our minds and in our emotions as we're going through pregnancy also affect the physical aspects of it, our physical health. They can affect the physical health of our pregnancy in a way that what we don't want and we don't need any more of is this idea that oh yeah, it's because of your weight that there's these risks or that these things are happening. It very well could be because of stress. And there's a lot of stress involved, like you said, and feeling from the onset in these situations othered and unwelcomed or not represented. And so I'm so glad that you're talking about that because the mental health aspect is really important the whole way through. And even during trying to conceive. So we've kind of talked about it all.
Yeah, I was going to say just a quick, easy example is I remember I was about 6 months pregnant and I was walking around the grocery store, grocery shopping, and I was just rubbing my belly like I like to do, and it's pregnant. And I just remember I was in the produce section and I just stopped for a minute and it hit me I'm a person of size walking around rubbing my belly. People probably think I'm hungry, but no one knows I'm pregnant. And it felt really isolating. And here I was doing water aerobics with a friend that existed in a very thin body, and everyone was doting on her. Everyone wanted to touch her belly, and no one, not a single person, asked to touch mine. And that was really hard. I haven't told that story in a while. That was really hard, and not every single person, but so many people were complimenting me on my weight loss because my body did change while I was pregnant. And so that was just reinforcing other messages that weren't healthy. And it was oh, you've lost so much weight. And I'm no, I'm pregnant. My weight is shifting. My body is shifting. And yes, I did lose some during pregnancy, but it was because I was loving on and treating my body unlike I ever had before. And so it's just so important that for people listening, like if you have someone who you know who's pregnant and exists in a larger body, ask them. Don't do it without asking, but ask them, like, can I touch your bump? Can I touch your belly? Because when you exist in a larger body, you so often feel invisible in that experience. And it just, you want to have annoying strangers want to touch, not everyone, but I did. I wanted to have people acknowledge that I was pregnant too, and I was glowing and I was beautiful, and I wanted that. And I didn't really have that except for from my friends and family and loving coworkers. So yeah, it plays a lot into your mental health, which can impact your physical health as well, for sure.
Yeah, you've brought this up a few times from the point of like doctors and the difference in their level of compassionate touch based on BMI and body size, and elsewhere as you then worked with your doula and midwives, and then here again, even just acknowledging like a bump and saying, hey, can I touch your baby bump?
Yeah.
There's this thread of, and it's called skin hunger, right? This idea of people in larger bodies not being touched and not having that connection, whether it's because of things like the bias in the medical community, or because our culture is set up not to be inviting and welcoming in other places where maybe we're less likely in larger bodies to get a massage or get a pedicure or have these experiences where our bodies are being compassionately touched. So then in these occasions, wow, that would truly feel so isolating.
Yeah. Yeah, it does. It does. So yes, touch all the bumps with permission. It's so important.
We're getting close to the end, and I want to be respectful of your time, but I'm wondering, as we're wrapping all of this up and we've talked about the medical side and also the cultural and social side of what it means to be a plus size pregnant person and have these experiences, what's the one thing you'd want to leave with the Real Health Radio audience in terms of, is there one thing you want us to know, something we haven't yet touched on, or something you just want to further drive home about being a plus size mommy?
I mean, it's my biggest soapbox, which is why we've talked about it so much. And I mean, there are a million different things that I can say, but I will continue to push and drive this home any opportunity I have, that you owe it to yourself to connect with a size-friendly care provider, not just during pregnancy. And I'm struggling with it now. I mean, I am just continuously trying to find a doctor that doesn't mention weight loss surgery before they touch my body. And that has happened twice now. And so it is so hard. I know I empathize with it, like sympathize with it, like I'm there, but you really owe it to yourself. And I don't care what size you are, like you owe it to yourself to work with a care provider that practices evidence-based compassionate care and that makes you feel good about yourself, and more importantly, makes you feel comfortable enough to address your healthcare concerns. And do not put off or stop going to the doctor because you've been shamed. I've been there. I was training for a 5K. I had just done a 5K and was getting over having strep throat. And I had to get an inhaler to help me breathe again. And I couldn't get into my regular doctor. And so I saw this person that was just like, oh, well, maybe you're just so big that you need to be on oxygen. And if she had just taken like 3 minutes to look at my chart, that I got cleared to do a 5K. And the result from that is that I didn't see a doctor for almost 2 years and I gained 60 pounds. And I knew the statistics, but I let it destroy me. So I just really, really want to drive home all these messages of like advocating for yourself, but also if you exist in a smaller body, like Lou said, look out for people of size. Be inclusive of people of size, from having chairs without arms to, I don't care who you're parked next to in a parking lot, don't park on top of another car, because it might not be able for the person to get in and out of their car comfortably because of these tight parking spaces with bigger cars. Like, just being mindful of all of these things that help people of all sizes to walk through the world with confidence and a level of feeling accepted can change people's lives.
Thank you. Thank you for that Great advice. I'm wondering now, what's your hope for the future of plus size pregnancy? If you could just wave a magic wand and get it all, what would you like to see?
That I'm out of business.
Yeah.
That plus size birth is no longer needed, that site doesn't need to exist, that everyone is treated with compassion and dignity, that every single store that carries maternity clothes carries them well beyond a 3XL, that I don't need to be around. And thankfully, I've seen some of that shifting, especially with Instagram and images. But like you, Lou pointed out, you don't exist in the same bubbles I do, and you don't see people of size represented as much as I do. So that was good for me to hear as well. But my ultimate goal is to no longer be needed. I would love that. I mean, I'd have to find something else, but I would love for there to be a day and time when I'm no longer needed, when my work and my voice is no longer needed.
Yeah, I had a feeling you were going to say that. I'm like, I know I'm going to ask this question and Jen's going to say that it's just pregnancy, that it's just birth. Like, exactly, that we don't have to tack the plus size onto it, and we don't have to have these specific spaces where pregnancy is embraced for all bodies, but that it's embraced for all bodies everywhere.
All bodies, all colors, all identities. Not everyone who gets pregnant identifies as a woman. Like, just pregnant bodies, be inclusive of them and provide people with the medical care they need, the clothing they need to be pregnant and comfortably and to embrace their body, the clothing they need to, if they are nursing, to chest feed or breastfeed their babies. It's so hard to find maternity nursing bras. It's like all of these little nuances that people don't think of, where we have a huge market of people ready and willing to spend so much money for these products. So yeah, I hope that it just becomes pregnancy. And I hope that by doing that we can change the cesarean birth rate for people of all sizes. There's so much work that needs to be done.
Totally. But I'm with you. That's what I always say. I'd like to be out of a job. And
Yeah.
I hope my clients, I love them and they can come back as long as they need me. But I'm always like, my whole point here is that you never have to come back.
Yeah.
So I totally get that. But for now, we're here, we're doing this work, and you have a plus size pregnancy guide. I'd love for you to share a little bit about it and tell our listeners where they can get their hands on it, because what you have to share and offer is so valuable and so necessary right now that I'd love for them to have that access.
Thank you so much. I wrote the book on anything and everything to know about being plus size and pregnant, and I just stuck to pregnancy. So it doesn't even go beyond, because there was so much that isn't talked about in regular pregnancy books. So it's like a lot of the things that we've covered here, but in way more depth. So where to find maternity clothes, encouragement for having pictures taken, and tips for connecting with a photographer that's size inclusive, to nutrition, to physical activity, to what are all your increased risks, but more importantly, how do you reduce your increased risks, and things to look out for. And it's all written in that compassionate, evidence-based, positive information that I so hungered for. Give me the facts, give me the information, but give it into me a way that makes me feel empowered, and connecting with a size-friendly care provider, knowing that it's not just the care provider, it's also where you choose to give birth. That's so important. Doulas, all of that information. So you can find it on plussizebirth.com. There's the My Plus Size Pregnancy Guide. And then, since I'm a podcaster now and launched a podcast 2 years ago, I have all this great audio equipment. So I also turned the book into an audio book. So you can get the audio book version that comes with the guide as well.
Oh, that's perfect. And yes, tell us a little bit about your podcast and about where else on social media and online listeners can get in touch with you or learn more from you, because I'm sure there's going to be a lot of people who want to get more.
Oh, thank you. Yeah. So my kid, like I said, is 9 now. We never ended up having that other child. So I realized, well, I love plus size pregnancy, and I will always be working on plus size birth. Hopefully not always, right? But at least for probably the next couple decades. There's so much more that I've identified with as a person of size, flying while fat, getting health care, talking about other issues that aren't always talked about of being larger, like going, like you said, massages, or I have a whole podcast episode on getting a Brazilian wax as a person of size, or getting any type of waxing, or those services. So I wanted to start talking about plus size lifestyle. So I launched the Plus Mommy podcast, which has been this wonderful adventure, and I get to connect and interview with powerhouses in these spaces. So that has been a wonderful journey. So you can find anything related to plus size and trying to conceive, pregnancy, and postpartum over on Plus Size Birth. And then I have, the Plus Size Birth Facebook and the Instagram that I'm working really hard to grow larger. But all the more fluffy body love, body empowerment messages are found. And that's where my major followings are, over on Plus Mommy. So the Plus Mommy Facebook is at like 178,000. And then the Plus Mommy Instagram is at 25,000. So you will know that you are not alone, and I talk about it all.
Thank you. We'll make sure all of those links, plus the other things that we've talked about here in this interview, are all in our show notes. So listeners, find them there and then go and say hello to Jen, because it sounds like you have a great community already built there, ready and waiting for people to come and join. Jen, thank you so much for joining me on Real Health Radio. It was wonderful to chat with you, and I look forward to connecting again soon.
Thank you so much for this opportunity, and truly thank you for the work that you do. I appreciate you.
Thank you. That's it for this week's episode. I hope you enjoyed it. Before I say goodbye, I want to leave you with a recommendation, and this time it's a movie. I'm going to stray from my typical love of documentaries, books, and podcasts here and give a shout out to Adrift. I guess it's not straying too far away from a documentary because it is based on a true story, but Adrift, which is currently streaming on Showtime right now, I'm watching it for free. Showtime is giving away their service in the midst of this pandemic. So if you're listening and at the time of listening, you can hop on that train and get some free Showtime, do it. But again, Adrift is based on a true story. It's the story of Tammy Oldham, who's played by Shailene Woodley, and Richard Sharp, played by Sam Claflin, who I love. And the two of them fall in love and determine to sail around the world, though they couldn't anticipate that they would be sailing directly into one of the most catastrophic hurricanes of history. I don't want to give the story away because it definitely kept my interest and also gave me a borderline state of panic for the entire 2 hours-ish that I was watching. But in the wake of the storm and with no hope of rescue, Tammy has to find the strength and determination to save herself and Richard. If you've got a few hours to spare and appreciate a good based on a true story type of movie with awesome effects and two of my favorite actors, then check it out. I swooned, I laughed, I cried. Hopefully you'll feel all the feelings too. And if this doesn't sound like your thing, then skip it. But maybe don't skip the free Showtime offer if that's still happening. Watch something you enjoy and then meet us back here next week for another great episode of Real Health Radio. Until then, you can find us at 7-health.com, and the show notes to this specific episode can be found at 7-health.com/195. That's SEVEN-health.com/195. As I mentioned at the start of this episode, 7 Health is here for you and continuing to take on new clients. So if you're interested in working together to heal your relationship with food, body, and yourself, or if you simply want to find out more, head over to 7-health.com/help and apply for a free initial chat with us there. Have a great week.